Weekly Checkup, brought to you by Dignity Health Central Coast.
Hernias are incredibly common, and most people don't even know they have them. Dr. Joseph Eisner, a general surgeon at St. John's Regional Medical Center, explains.
They present as a bulge either in the groins, we call it the inguinal area, or the belly button, or the umbilical area. And they cause pain whenever people bend or lift, and in rare circumstances, intestines can get stuck in there, and that would be a medical emergency.
Fortunately, St. John's has the newest and most technologically advanced laparoscopic surgery equipment used to repair hernias.
For a laparoscopic inguinal hernia, we use small 1 centimeter or 5 millimeter incisions as opposed to the traditional 5 to 6 centimeter incision. And we separate the layers of the abdominal wall and then use the camera's equipment to identify the holes, which essentially is what a hernia is. And we either close them with permanent sutures or put a permanent piece of mesh to cover the hole. The new equipment is ultra high definition screens that allow to see much more detail and therefore decrease any risks of complications. They're easier to use, which makes the surgery shorter, which improves the patient outcomes.
To learn more, visit dignityhealth.org/Central Coast.
Weekly Checkup, brought to you by Dignity Health Central Coast.